Have you noticed your blood glucose levels creeping up again, even though you're still taking Rybelsus? It isn't unusual, and it doesn't necessarily mean something has gone wrong. Type 2 diabetes is a progressive condition, and understanding why your medication might seem less effective over time is the first step to doing something about it. So let's talk through the main reasons this can happen and what your options are. Rybelsus contains semaglutide, which belongs to a class of medicines called GLP-1 receptor agonists. It works by encouraging the pancreas to release more insulin when you eat, reducing a hormone called glucagon that raises blood sugar, and slowing down how quickly food leaves your stomach. Together, these effects help keep blood glucose more stable throughout the day. Now, one of the most important things to know is that the initial tablet strength is mainly there to help your body adjust to the medication. It isn't intended to control blood glucose on its own. Your clinician will usually review and adjust your dose after the first month if appropriate. If your dose hasn't been reviewed since you started, that could be part of the picture. How you take Rybelsus also matters enormously. The way and timing of how you take it directly affects how well it's absorbed. Take it exactly as directed on your prescription and in the patient information leaflet. And if you're ever unsure, ask your pharmacist. Even occasional mistakes with how it's taken can significantly reduce how well the medication works. Beyond that, lifestyle factors can play a real role too. Weight gain, less physical activity, changes to your diet, or periods of increased stress can all affect your blood glucose control and can make it seem as though your medication has stopped working, even when it hasn't. And then there's the nature of type 2 diabetes itself. Because the condition is progressive, the pancreas gradually produces less insulin over time. Medications that work by stimulating insulin release may naturally become less effective as this happens. This isn't a failure of the medication. It reflects how the condition evolves. So what signs should you look out for? If your HbA1c, the longer-term measure of blood glucose control, has risen above your agreed target, or if you're regularly experiencing symptoms like increased thirst, frequent urination, or unexplained fatigue, those are signs worth discussing with your doctor. And if you're experiencing very high blood sugars alongside dehydration, vomiting, drowsiness, or confusion, seek urgent medical advice straight away. If you're concerned that Rybelsus isn't working as well as it used to, the most important step is to book a review with your GP or diabetes team. They can look at your recent results, review how you're taking the medication, and assess whether your current treatment is still right for you. Please don't adjust your dose or stop treatment on your own. Always follow the guidance of your prescriber. If it's confirmed that Rybelsus is no longer providing adequate control, there are several directions your doctor might consider, such as switching to an injectable GLP-1 medication, adding an SGLT2 inhibitor, combining treatments, or in some cases, moving to insulin therapy. The right path will depend on your individual circumstances and what's recommended under current clinical guidelines. To summarize, if Rybelsus seems less effective, there may be a straightforward reason, like how it's being taken or whether the dose is right for you. Type 2 diabetes does progress over time, and it's completely normal for treatment plans to need adjusting. Always speak to your GP, diabetes team, or pharmacist before making any changes. They're best placed to guide your next steps. This video is for general information only and doesn't replace personalized advice from your healthcare team. If you're worried about your blood sugar or feel unwell, contact your GP, your diabetes team, or NHS 111. In an emergency, always call 999. If you found this helpful, give it a like and subscribe to the Bolt Pharmacy channel for more medically reviewed health information, and leave a comment below if you have questions about managing type 2 diabetes.